This is your host, Kamal, reporting from Carrington. We have the RN 7-day forecast. So Monday, Tuesday, and Wednesday are rainy days due to midterms. Thursday, we see some sunshine, but that depends on our grades. Friday, Saturday, Sunday is sunny. Thank you.
This message is being broadcast by the Department of Defense of the Republic.
Hi, I'm Dr. Papaleo. I only have 15 minutes, so we're going to make this quick. We're going to talk about seizures. Type of epilepsy is seizures. So with the different types, you get various symptoms and causes, but repeated seizures is what we're talking about. That's the symptom. A seizure is caused by a cluster of abnormally acting neurons that fire off spontaneously, creating a spread of electrical signals to adjacent or distal areas in your brain. If the activity produced by the neuron spreads to the entire brain, it's referred to as a general seizure. If it's only in one place, that's a focal seizure. The stimulation through the brain changes how a person feels, senses, thinks, and behaves. So when someone has a seizure, it's broken up into 4 phases. You have the prodromal phase. This is the sensation or behavior changes that occur. You have your oral phase. This is something that the patient senses. It's usually the same every time, and they know that the seizure is coming. Then you have your ictal phase. That's the whole seizure from start to end. After that is the post-ictal. That's when you are recovering. So depending on whether the seizure is generalized or focal will determine your manifestations. Generalized seizures usually present with a brief or possible altered consciousness lasting anywhere between a few seconds to several minutes. They fall to the ground, their extremities may be jerking, salivating, tongue and cheek biting, incontinence, cyanosis. It's not pretty. So if the person remains conscious, the seizure may look like a brief staring spell when they appear to be daydreaming, or they may accompany hand movements or blinking. Focal seizures usually present with the person being conscious in an altered or unaltered state, depending on the location of the disruption. For example, if the discharging focus is located in the medial axis of the postcentral gyrus, the patient may experience paresthesia in the leg on the opposite side. So, other symptoms can include unexplained feelings such as joy and sadness, hallucinations, lip smacking. Following the seizure, the patient may be tired, have sore muscles, be confused, may not be able to return to normal activity. But for the caregiver, make sure you write all this stuff down and tell the doctor, because we need this information. When did it start? What happened? So when they come to the clinic, we're not usually going to see the seizure, but we're going to take note of it through an electroencephalography. That is an EEG. This is painless test. We can also look at your brain waves, the spikes, the electrodes, sharp spike, sharp pain, sharp wave, spike and pain and wave and all that. It all goes together. So magnetic reasoning image is another way, in addition to the EEG, that we can look at the brain. It shows us if you're
paging Dr. Papaleo to the emergency department.
I told you I only have 15 minutes, so I'll have to talk to you guys later. Thank you.
If you or a loved one has been affected by seizures, you may be entitled to financial compensation. Exposure in nursing school may put you at risk. Please do not wait. Call 1-800-99-LAW-USA today for a free legal consultation and financial information packet. Seizures patients, please call now.
Hello, I am Michelle Govea, the pharmacist, and I'm here to tell you that the most common form of treatment for epilepsy is medication. That's right, more money in my pocket. So, most people who experience epileptic seizures take medications on a regular basis in order to help prevent or manage their seizures. This includes medications that are considered primary and are usually the major form of treatment, as well as medications known as rescue medications. There are many drugs that will help in preventing symptoms that will alleviate symptoms of epileptic seizures. It is important to recognize that medications are usually lifelong. Some common medications include phenytoin, valproic acid, oxcarbazepine, lamotrigine, just to name a few. Yes, they're difficult to say, but I know how to spell them. As with many medications, serious side effects can occur. Side effects include trouble with thinking, memory, problems with coordination and balance. Those seem like pretty important things. Some patients will experience mood changes or even upset stomachs, general feelings of tiredness. Medicinal therapies often need to be evaluated and titrated to the individual in order to find a correct therapeutic dose for that person. Now, I asked myself, I said, "Self, how do these drugs manage seizures?" And I could not in fact answer that, so I had to go to a book and look up the answer. The major pharmacologic effects of the reduction of the nerve's ability to be stimulated decrease the speed of the nerve impulse conduction within the neuron, and slowing the influx of calcium and sodium ions across neuronal membranes. Most drugs have more than one mechanism, but regardless of the type of medication prescribed, it is important to adhere to the prescriptions properly and to report any adverse effects to the healthcare provider so proper management can take place. There is a little black box warning on anti-seizure medications, but what's the alternative? Do not stop taking your anti-seizure medication drug without first consulting your physician. Do you guys understand that? Do not stop taking your anti-seizure medication drug without first consulting your physician, as this can cause rebound seizures, and those can be life-threatening. Another form of treatment involves what most of us do every day, and that involves eating.
Hey, have you heard about the new seizure pandemic?
Yeah, my doctor said I have that.
Yeah, what happens to you?
Like, I feel lightheaded, and then I fall to the ground, and I was shaking.
Welcome in. What can I get for you ladies?
Can I have a seizure salad?
You beep, beep, beep.
Welcome back. Today I have with me Stefan.
That's Steven, actually.
Steven, who is suffering from epilepsy. So Steven, tell me about your experience with it.
Well, hello. Thanks for having me talk about my experiences. It's been a difficult time. I was first diagnosed with this, and they took my driver's license. It's kind of a big change in life. I had to use public transportation. Not easy to do at all. It's disrupted my life significantly, and it's just been not the funnest time right now because it just happened not too long ago. So.
Can you explain me your hospital stay when you were first suffering with it?
Yeah, so when I first got there, the nurses came in and they kind of gave me what their priorities were for this. They first started asking me questions about my seizure. I really didn't remember much. Actually, I don't even think I remember what happened, and I just woke up in the hospital one day. But she seemed to keep asking me these questions, kind of trying to find out maybe what happened right before the last thing I remembered. She was telling me these are trying to find out some triggers and maybe what the onset was. And then the next thing they went into was trying to tell me what I need to do. What they're doing actually is to make sure I'm safe. She said, she put padding on all the bed rails and then explained to me, well, that's for your safety. And it's when you go into a seizure, sometimes you start jerking around and you could hit yourself on it. So that's what those were for. Then they also told me they had all these supplies. We got our suctioning, and for suctioning and thing that they put in your mouth. I think it's some type of wand. I can't remember what they called it. But so they had all that, so just in case I was to have a seizure, they were prepared. And then they said they had medications readily available if anything needed. And then the last thing she educated me and my family on what I need to do when I'm out of the hospital and what that needs to be done inside if something happened like that. They also recommended that I get a medical alert bracelet, and then another unfortunate thing is she said I need to avoid alcohol. I was kind of sad that at that point. But yeah, those kinds of, I think they said priorities that they were trying to teach me while I was at, that was their main priorities for me when I was at the hospital.
Okay, thank you for sharing your experience, Stefan.
But Stephen again.
Oh, Steven. So I had Stefan with me sharing about his
I'm sorry.
experience. I'm so sorry, Steven.
Oh, thank you. Appreciate it. Did you want to know anything else? Like, I saw a lot of people there.
Oh, yeah, you could tell me about the people you saw there.
Sweet. So I was actually surprised how many people came into my room, and half of them I don't even know who they were. So, but the ones that stood out to most to me was like the pharmacist. She was actually telling me, like, when I first came to the hospital, they gave me Valium, and because I guess my seizure wasn't stopping, and she called it something like status epilepticus, something like that. I don't remember. I'm horrible with these medical terms. But then she said that my prescriber has told me I'm going to be taking phenobarbital for my ongoing treatment, and said if that doesn't work, they may give me another medication to take with it, like maybe, what was it? She called it valproic acid. But then then I had a surgeon come in to talk to me. He's saying, well, if none of this medication works, there is maybe a possibility for a surgical procedure, but they have to meet criteria. So, like, main one is medication not working, and then I have to be diagnosed with a disorder, which I am now. And then he says that surgical process is about 70-80%. It is about 78% of people get it. They lose their seizure free, and 10 to 20% have reduced seizures. And then the last person I saw was the nutritionist. She gave me some dietary information that could help, and she called it the ketogenic diet. I guess it's a high fat, low carb diet. It's supposed to do something with the glucose and ketones and replacing it in my brain. I don't know. It's a lot of medical terminology I'm not sure about yet. But she said it could help. And she says normally it's a treatment for children, but it's equally effective in everybody. So that was good news to hear. And the best news I found out is if I get it all treated and under control, I could get my license back. And that will definitely help me in the long run.
So I have one more question. So you're saying the pandemic is real?
Oh, I don't know about that.
Okay, so this was Stefan telling me
Steven again?
that the pandemic is real.
Hi, I'm Nurse Eva, and I'm going to talk to you today about seizures. So seizure first aid is a matter of taking precautions. You're most likely to need it for a generalized tonic-clonic seizure. Keep other people out of the way, clear hard or sharp objects away from the person, and don't try to hold them or stop the movements. Place them on their side to keep their airway clear. Look at your watch at the start of the seizure to time its length. Don't put anything in their mouth. Contrary to popular belief, you can't swallow your tongue during a seizure. But if you put an object in their mouth, they could damage their teeth or bite you. Milder seizures, like brief periods of staring or shaking of the arms or legs, aren't emergencies, but you should gently guide the person away from threats. They may be in a state like sleepwalking, where traffic or stairs pose a danger. All seizure activity should be reported to their doctor. Call 911 if the person has difficulty breathing or walking after the seizure, or if the seizure lasts longer than 5 minutes. Here are things to document for my fellow RNs. Before the seizure, how did it start? Were they awake or asleep? Were there any triggers? Did they have any unusual sensations such as taste or smell? Did they have a rising feeling in their stomach, numbness, or pins and needles? During the seizure, we're going to document how long did the seizure last, and did they become stiff or floppy? Did they lose awareness, appear dazed or confused, or lose consciousness? Did they become pale, blue around the mouth, or flushed? Were their eyes open or closed during the seizure? If open, were their eyes turned to one side? Was there any movement such as jerking or twitching? Was it symmetrical or not symmetrical? Did they make any noises such as mumbling, speaking incoherently, or repeating words or phrases? Did they bite the inside of their cheek or their tongue? After the seizure, we're going to document how were they afterwards? Were they confused or sleepy? If they slept afterward, how long? How long did it take them to fully recover from the seizure and return to normal activities? Thank you.
Welcome back to the last segment of the show. This is where I ask you 3 NCLEX questions about seizures. The first question, you're assessing your patient load for the patients who are at most risk for seizures. Select all the patients below that are at risk. A 32-year-old with a blood glucose of 20. B, a 63-year-old whose CT scan shows ischemic stroke. C, a 72-year-old who is post-op at day 5 from open heart surgery. A, 16-year-old with bacterial meningitis. Or E, a 58-year-old experiencing ETOH withdrawals.
Let's redo it real.
Welcome to the last segment of the show. In this segment, I'll ask you 3 NCLEX questions pertaining to seizures. First question, you're assessing a patient load for the patients who are at most risk for seizures. Select all the patients below that are at risk. A 32-year-old with blood glucose of 20. B, a 63-year-old whose CT scan shows ischemic stroke. C, a 72-year-old who is post-op day 5 from open heart surgery. D, a 16-year-old with bacterial meningitis. E, a 58-year-old experiencing alcohol withdrawal. I'll give you a minute to think about this. The correct answer is A, B, D, and E. Question 2. A 70-year-old male patient is being evaluated for seizures. While in the child's room talking with the child's parents, you notice that the child appears to be daydreaming. You time this event to be 10 seconds. After 10 seconds, the child appropriately responds and does not recall the event. This is known as what type of seizure? A, focal impaired awareness. B, atonic. C, tonic-clonic. Or D, absence. The answer is D, absence. The last question. The nurse enters the room as the client is beginning to have a tonic-clonic seizure. What action should the nurse implement first? 1. Note the first thing the client does in the seizure. 2. Assess the size of the client's pupils. 3. Determine if the client is incontinent of urine or stool. 4. Provide the client with privacy during the seizure. I'll give you a minute to think about this. Correct answer is 1. Note the first thing the client does in the seizure. Thank you.